what are the first aid measures to be followed when a patient is having seizures? So, first and foremost thing is that majority of seizures stop by themselves within 2 minutes. Only in rare circumstances the seizures prolonged beyond 2 minutes. So, first and foremost thing is not to panic. You commonly see that patients, when they have seizures, the family members tend to panic around and they do things which are not necessary. So, there are a lot of myths regarding what to be done. So, people indulge things like putting inside the mouth, they try to put the spoon inside the mouth, they try to put sugar inside the mouth, they try to put inside fingers inside the mouth, they try to hold the patient and even give the patient a sniff like things like a shoe or socks or garlic. All these things, mind you, will not control seizures. So, seizures stopped by themselves. So, it is important that a patient who is having seizures is made to lie down in a comfortable place and which is free for any sharp objects, so that there is no injury happening. If possible, the patient should be turned to one side, so that whatever saliva and secretions which are accumulating in the mouth during the seizures, they fall out and patient doesn't aspirate those secretions inside his lungs. And if possible, we can keep a pillow under the patient's head to prevent head injury. And it is important that the patient has fresh breath, so that oxygen deficiency doesn't happen. And one of the family members should time the seizures, so that they know that if the seizures beyond 2 minutes are there, they can use some rescue medicines like a nasal spray, which can help in controlling seizures, and if necessary they can, the other family members can also call the ambulance if seizures are not being controlled. So, by doing this, majority of seizures get well controlled, but in cases where they are uncontrolled, it is always imperative that an ambulance is called out and the patient is shifted to a center where the seizures can be immediately controlled and they can be given some medicines for controlling seizures in the transit. So, next coming to what is the treatment for epilepsy. So, epilepsy is a neurological disease, as I told you, and there are simple drugs which are available widely. There are a lot of drugs which are available which can be safely taken for controlling epilepsy. So, these medicines what we call are anti-seizure medicines or anti-seizure drugs. These medicines, if they are taken regularly, seizures become well controlled in majority of patients. So, by taking medicines, roughly about 70% of patients have good control of seizures and good control of epilepsy. So, these medicines should be recommended to be taken daily on a once daily basis or twice daily basis, depending on the doctor's prescription, and the patient should take regularly medicines without skipping medicines. He should ensure that both the medicines are taken regularly and there has a toolbox, so that he remembers that what medicines, pill box, so that he remembers what medicines are to be taken when. And it is imperative that the patients regularly follow up with the doctor, and the dose of the medicines should be adjusted based on the patient's seizure control and also the patient's body weight and the age. So, after taking medicines, about 70% of the patients get very well controlled seizures. So, what are the options for the patients in whom seizures are uncontrolled despite taking medicines? So, as I told you, in 30% of patients with epilepsy, they tend to have recurrent seizures, unfortunately, despite taking medicines. So, in these 30% of patients in whom seizures are uncontrolled, the best option for them is to find out if surgery in the brain will help in controlling seizures. So, there in patients who have uncontrolled seizures, that is, they have recurrent seizures despite taking 2 or more medicines. In those patients, they should undergo evaluation at a center where the comprehensive epilepsy evaluation can be possible, and after doing that, the patient workup can be completed, and if possible, the patient may benefit from a surgery of the brain which is aimed in controlling seizures. So, there are various surgical options possible, some of which involve removing a small part of the brain and others which involve a wider part of the brain. It all depends from where in the brain the seizures originate and what is the MRI issue located. And in certain patients, apart from brain surgery, there is the option of pacemaker implantation, like device known as the vagus nerve stimulation, where we implant a simple battery and a pacemaker in the neck around the collarbone, in the vagus nerve, which is connected internally to a pacemaker like device which is placed under the collarbone. So, this device helps in controlling seizures in patients in whom brain surgery is not feasible. So, apart from that, other therapies available, like in children, there are options of dietary therapy like ketogenic diet, etc., where the patient is advised to take high fat and low carbohydrate diet, which has been found to have medical benefit in controlling seizures. So, these are the various options for patients whom seizures are not controlled. So, coming to what are the do's and don'ts for any epilepsy patient. So, for as I told earlier, for epilepsy patient, important thing is that they should have peace of mind. So, lifestyle is very important apart from medicines. So, patients should ensure that they are relaxed, they take medicine regularly on time, they eat on time, they sleep on time, and they avoid unnecessary recreational things like consuming alcohol, smoking or other over-the-counter medicines should be avoided. And the patients should ensure that they meticulously follow the advice given by doctor on a daily basis. And coming to what are don'ts, in general, a patient who has seizures, we recommend them not to drive a car, and because if they have seizures while driving, it can be harmful for them and also to the public who are nearby them. So, this is for safety purpose, we recommend the patient not to drive. And apart from that, they should also not indulge in activities which may be potentially dangerous, like swimming or going to high altitude and engaging in some risky sports, adventure sports, bike racing, car racing, etc. So, all these things should be avoided. Apart from that, epilepsy, as I told, a lot of myths, and people think that it is bad omen, and still people indulge in various things like conducting even sorcery or conducting various pujas, black magic, etc. So, all these are misconceptions. Epilepsy is a scientific basis and it is proven that it is a neurological disease. So, people and family members especially should not indulge in things which may not have any benefit. So, for any queries, kindly contact us in the given contact number and email ID, and we will be always be there to clarify any doubts. With this, I end my presentation. Thank you.